Now, one federal Liberal MP has an advantage in this debate. Andrew Laming was a doctor and he's been pushing hard for the bans on elective surgery to be dropped, bans that were meant to free up beds for the flood of coronavirus victims that never came. Now, some of the bans are now going to be relaxed. Andrew Laming joins me now. Andrew Laming, thank you so much for your time. As of
Great to be with
As of 4:30 today, Andrew, there were just 8 new infections in the country over the 24 hours, none at all in South Australia, none in Western Australia, none in Tasmania or the Northern Territory, just one in your home state of Queensland. Do you think it's time now to relax some of the bans, not all of them obviously, but some of the bans now and not in 3 weeks' time?
We know there's this conversation going on at the moment, Andrew, but we don't want to be here in 3 weeks' time with nothing changing. So you can't go any lower than 0 cases. So experts around the world ask for the life cycle of the virus to incubation, which is about 7 days in 95% of cases, to be domestic case-free with no identifiable origin. What that means is that there's nothing popping up in the community. South Australia is almost there. Queensland, WA will be there next week. And of course, Victoria, New South Wales will be the last. So over the next 2 weeks, all of them should be initiating the conversation at different times. We now have what was really important, Andrew. We've got this 10 days of consecutive falls in hospitalisations, ICU and ventilation. So the hospitals are not the concern. We've now done extensive testing in the community. Hidden disease is not the concern. And the last thought in front of the Chief Health Officers should be complacency. There was not a single spike over Easter because Australians did what they were asked to do. They now need to be rewarded with real-time evidence about how we open up this community. I'm glad you mentioned Kevin Rudd. He was indeed timely, he was targeted, but he wasn't temporary, as you've pointed out many times. He kept spending and didn't know where to stop. We've got to make sure that having rolled into this quickly, like a full court press or a rugby scrum, the way out's a maze. We've got to plan it well ahead. It's going to be slow, painful, and the risk is, of course, more deaths. So these health officers, they know they're holding the lives of Australians in their hands, but they need to be reminded they're also holding the livelihood of thousands of Australians who are out of work just in case. And now the disease is gone, they need to be the first coming back to work.
Look, I think you're absolutely right. And you're right to point out that you're going hard, which I totally supported, going hard, because the argument then was take the pressure off the hospitals so that they have the resources to keep people alive. That was crucial. Well, that's clearly happened. I mean, that happened weeks ago now. And I think you're right. We should be looking at a targeted state-by-state approach. What bans would you like to see relaxed and when? Particularly, look, say Queensland, no infections 2 days ago, 1 over the last 24 hours, none a few days ago again. Surely that should be able to start relaxing bans from next week.
So there's 2 considerations. First of all, PPE was a concern, and many of my health friends were saying their hospitals simply weren't stocked and prepared. Taiwan, they always had a month to 6 weeks of PPE, but we helped fly in 260 million pieces of PPE 10 days ago, Andrew. They've got no excuse. And when I told the Health Minister about that, he said, well, we're also bringing in similar quantities for the public system. So Australia's now awash with PPE. It's just got to be distributed. The second point is that we're still paranoid about a second wave, and I just politely point out that northwest Tasmania, probably the most remote, oldest, coldest, with the weakest health system, has nailed their outbreak in 12 days, and they've had consecutive no days of infection also. So they're no Italy, right? We've managed to do it with the help of the army and the boys in khaki, as they say. We've absolutely repressed that breakout, so we don't need to be paranoid about second waves. We know we can handle them. So in answer to your question, we need to reverse, just as we went into this thing, first of all, unlocking the economy. And all of those personal services workers out there, massages, PTs, the complementary medicine, the tattoo shops, small-scale dining and hospitality that doesn't involve, crowds or congregation. Well, Taiwan's never stopped doing any of that, and they've had just 6 deaths in their entire population, the same as Australia's. So we were right to stop it. But we needed to be collecting evidence. And you've got 67,000 hairdressers out there who didn't spread 1 case to our knowledge because they worked so hard, they were sterilising capes, they were warning all of their clients to space. So that profession has given us the natural experiment to be confident enough to say, if hairdressers are looking after this end of the body, we can let the therapists do the rest of the body. wearing a bit of PPE. Let's put them back to work, Andrew. There are tens of thousands of these people. They never deserve to be called non-essential, and they need to be able to go back to work because we've got the evidence coming in from Taiwan.
Your point about the hairdressers, I hadn't thought of it. Brilliant. I mean, these are people right in people's faces where you'd expect them to get infected if that was a bigger risk, as we're told. And you're quite right. I haven't heard of a single case of that infection being spread through hairdressers. Brilliant example. Andrew Laming, may your voice ring loudly in the halls of the government. Thank you so much indeed for your time.